Every children's facility in the state is absolutely full.
90% have preventable illness that they don't need to be hospitalized for.
These are the darkest days of the pandemic.
This is now not just about the COVID patient. This is about you, the general public, that we cannot provide quality care for you.
Many of Louisiana's hospitals are warning that right now they can't offer adequate care to anybody. More than 2,000 COVID patients are already hospitalized, shattering the state's previous record in January. And the head of Children's Hospital New Orleans says there hasn't been an open intensive care bed in weeks. As the AP put it, hospital leaders across Louisiana described staff shortages, emergency rooms packed beyond capacity, and non-emergency surgeries for cancer patients, knee injuries, and other problems sidelined until the pressure eases. For more, we welcome to the broadcast Dr. Phyllis Mason. She's the Chief Medical Officer of the Natchitoches General Regional Medical Center in rural northwestern Louisiana and also a board-certified OB/GYN. So good of you to be here with us. You were one of the leaders speaking at the governor's press conference. What's happening at your hospital?
First of all, I just want to thank you for allowing me to have this platform to speak about this important subject. And I just thank you for being here. But at our hospital, at Natchitoches Regional Medical Center and in Natchitoches, Louisiana, what we're seeing is the increased volume. A month ago, we had 0 COVID patients. Today, we have 10. Our ICU is full. We're a small hospital, so we have an 8-bed ICU. 7 of those patients have COVID, one of which is pregnant. And what we're also seeing that this is really taxing our staff. We're short on nurses, we're short on staff, and we really feel like here we go again. And the morale is low. And so we're really struggling with the challenges that we're facing right now with this pandemic.
So if I'm there and I have a heart attack or I get into an accident or I am in need of the emergency room and maybe I have to wait and wait, what's the danger?
And right now, what is happening is, and what I talked about at the press conference was the bottleneck. And so what we're finding is that because we don't have the staffing available, the capacity available to take care of patients, we're having to board patients in the emergency room. Sometimes 2, 3, 4 days that we're having to just keep patients in the emergency room until we can get them into a bed in our hospital. In addition to that, hospitals in the state are full. And so we're unable to transfer patients out that need to be transferred out to a higher level of care. And what that means for you with a heart attack is when you come in, we may not have the staff available to take care of you. Or you might be sitting in our waiting room and you're having chest pain. But because we don't have the bed available to pull you back into our emergency department, now you leave without being seen. And we found that our left without being seen patients has increased because of this. So you might leave without being seen, and then you go home and have a heart attack and pass away. And it really is one of those things that really can touch your heart and make you cry. Is when you know that as a healthcare provider, you're not providing the same quality of care that you desire to do so to your patients as we did pre-pandemic.
How do you even process that or deal with that? You know, you take the Hippocratic Oath. Your job is to heal. You can only do so much. I saw an article in The Advocate saying that Our Lady of the Lake Regional Medical Center in Baton Rouge got a 33-member disaster strike team from the federal government. I mean, for a small rural hospital like yours, can you even get something like that?
Actually, we can't get it. It's going to go to the larger hospitals, and that's the right thing to do. So it will go to the New Orleans, Baton Rouge, Shreveport, which are the larger hospital and medical centers, and that is the right thing to do. What that does for us, though, is it allows them to have more capacity to accept our patients.
Okay.
So then now maybe we can move our patients, and then that increases our capacity for what we can take care of in our hospital. But your question is a very good one about how do you deal with that? And, you know, you go home, and you sit down and you eat a good dinner and you go to bed and you wake up and you do it again, because it really is about the patient. It really is not about me. It's not about this pandemic. It's not about any of that. It is about that patient in that bed that I want to take care of. And one of the things we might not have the capacity, but when we take care of you, we're going to take care of you with care and compassion.
We only have a minute left, Doctor, but the governor's indoor state mandate officially begins tomorrow. How much do you think that might help the surge now? Are you confident people will actually comply?
I am. I think the mandate will definitely help. We know that masking helped. The last time that we had a masking mandate with restrictions, it flattened the curve for us. Businesses are going to comply, which will encourage people to comply. So I do think it's going to be a game changer and it is going to make a difference.
I can't thank you enough for everything that you do. I know that the folks there in rural Louisiana thank you. And I'll just also comment that when you say you go home and eat a good dinner, if you're in Louisiana, that's almost like repeating yourself because you get good dinners when you go to Louisiana.
That goes without saying in Louisiana, you got good food.